Chatting to my colleague outside the inquiry this morning, not due to conclude until 2026. That's too long.
It is far too long. The desire to answer the concerns of families is entirely right, but there are practical matters about preparing this country for what is likely to be another pandemic sometime in the future. That work should be done today, and it's taking far too long to learn the practical lessons of the mistakes that we made the first time round.
And do you think the length of this inquiry is going to delay our planning for a future pandemic?
And it already has done. We have gone backwards rather than forwards in being ready for any future pandemic. We have taken our testing facilities and infrastructure down. Our surveillance isn't good enough, and I saw John Edmonds talking about this last week. We do not have a good pandemic plan in place. UXA is not strong enough or tough enough in order to have influence in Whitehall. We really should be leaning into this issue much, much more heavily.
Lots to ask you about this, so let's see if we can bump into some of the points that our viewers are most concerned about, not least this COVID disinformation unit that we've been reading about in the Telegraph particularly, suggestions that the government was keeping an eye on some social media that they felt was being negative about their behaviour towards COVID. That can't be true, surely.
OK, I hate to break it to you, but I'm keeping an eye on you. And before I came on here, I did a thorough search of what you had said about the inquiry and about COVID in the last few months. I hope that doesn't come as a shock to you. In fact, that's just part of being a professional person engaged in the media. Of course, government keeps an eye on what is happening.
That's a bit North Korean to me.
No, that is practical. What is the important question is what do they do with that information? Was there undue pressure or process with the social media companies to somehow take down or distort what was put on the... Well, that is not what's clearly being demonstrated. The social media firms do have service-level agreements. They do have their own frameworks for what should and shouldn't be on social media. And challenging them to apply their own rules is reasonable. And that is what I think happened. But I am interested to find out more about what comes out of this.
OK. Let's ask about Helen Whately next, if I may. She was a junior health minister, or a health minister, let's say. She worked under Matt Hancock when he was health secretary, and she refused yesterday to repeat his view that a protective ring was thrown around care homes during the pandemic. What do you think happened?
I don't think she refused. She said exactly what I would have said, which is that we tried our hardest to protect social care. This was not a conspiracy. This was dealing with the legacy of a long time of lack of investment in social care. I remember at one point...
Did you protect care homes?
We did our best. I'd remind you that we had almost no tests at all. At one point, we were running about 1,000 tests for the entire country per day. We hardly had enough tests to test people who were going into surgery, let alone the millions of people who were in social care. Now, we scaled that as quickly as we could, and when we did, we pivoted to giving people in care homes tests. But right across the world, there is a lack of tests, and we'd be foolish if we pretended that somehow there was a box of tests that we weren't using.
Do you acknowledge that some of the most vulnerable people were the ones in care homes?
Oh, for sure, and we knew that from the outset.
That people in hospital who were going back into care homes would have had COVID?
Yes, but I would also have acknowledged... I would have also acknowledged...
Let me just make my point. Why then people who had COVID, that you knew would have had COVID, why did you put them back into where a group of people were extremely vulnerable?
Well, one reason was that if they stayed in hospital, there was even more COVID in hospitals than what was in care homes, so they were safer in care homes.
What about the ones they were going back to live with?
And we did our best to test, but if you have no tests anywhere in the world, there's nothing you can do to magic up tests that don't exist.
Tell me that you knew, beyond all reasonable doubt, that these people had COVID, and then you knew that these people were vulnerable, and you put them the two together.
No, I didn't say that I knew that they had COVID. What I said is that
you said beyond reasonable doubt.
Anyone who goes to a hospital in the middle of a pandemic is in the riskiest place possible. And so a proportion of them...
with people who are most vulnerable?
Well, on the whole, the protocols were to keep the people who hadn't been tested into some kind of seclusion and isolation. And those isolation protocols worked on the whole.
They did.
Well, the reason why they didn't work, it emerged, was that the people who were spreading COVID were the people who were working in social care. And as the evidence emerged, as Helen has said in her statement, as the evidence of nosocomial infection, i.e. the people working in social care who were moving from house to house and home to home, were the ones who were actually spreading the disease. We stopped that practice and stopped people moving around, and that had a big impact, much bigger impact than actually bringing in the tests.
So where was the ring of steel then if the people were moving around?
Well, the words that Helen used, I think, were exactly right. We were absolutely on this problem from the very beginning, from the moment we'd heard about the pandemic.
Why didn't you stop people moving around to start with?
Well, we didn't know a lot about the pandemic at the beginning. We didn't know whether it was...
We have a lockdown and you have to have an abundance of caution, and you didn't.
Well, we had to prioritise lots of different things. The protocols for stopping people moving around were incredibly tough.
Obviously not.
So you can't do everything all of the time. When we realised that that was actually the way it was being spread...
How did you not have realised
Well, for one reason, we didn't know how it was spread. We didn't know it was by touch or through the air. You're making an assumption that we knew exactly...
You have to do something differently.
No, we had no idea how
In which case you need to be even more cautious.
We were as cautious as we could have been under the circumstances. If we had tried to do everything all of the time, then we would have had a shambles.
But it's not a protective ring, is it? It's not a protective ring around care homes and others who are most vulnerable if we didn't know how this COVID pandemic was being spread.
Our aspiration was to do the best that we could, and I think that we did. Well, that's where I'm.
That's different.
That's where I'm coming at it.
Aspiration
And had
and
you
COVID
been
ring
there,
of steel are very different.
You would have been incredibly impressed. I would pay testimony both to Helen and to everyone in that social care team who bust a gut and did as much as they could have done in order to protect those in social care.
Including Matt Hancock, did he do
Absolutely. The whole
Even though
system...
he says it was a COVID ring of steel and it wasn't.
The whole system was very focused on protecting. We'd seen what happened in Spain. We'd seen those care homes where everyone died. We didn't have anything like that in the UK.
Is that your benchmark?
It's not a benchmark, but I'm trying to convey to you that we knew what the dangers of not doing the job well would have been.
So because not everyone died, it was a success?
I'm not saying that. I'm saying that we were very conscious from the very beginning, from when those stories came through, that those were the risks of not getting it right, and the fact that something like that didn't happen demonstrates that we did get some things right. And don't think it's fair to pretend that it all went wrong.
So why didn't you isolate elderly people in hospitals or these Nightingale hospitals that cost us a fortune that weren't used and until you knew what was going on?
That's a really good question. It is totally impossible to isolate people. You cannot, with this disease, which is so communicable, lock someone in a cupboard and say that no one's going to go and see them. No one's going to care.
You spend
well, that's what
£8 million a week, I think, on the one just down the road.
In hospitals, we have shared wards. We have
talking about
teams
the Nightingale hospitals.
Well, in the end, the Nightingale hospitals, on the whole,
you didn't use them.
Well, partly because we didn't have enough people. We didn't have unlimited numbers of people to care for each individual patient on an individual basis, particularly if they didn't have any symptoms of the disease. I mean, we're talking about millions of people where we just don't have enough staff to do that. So you're creating a what if that isn't realistic for the resources that we had.
I'm sure they'll be asking in the inquiry, and they're taking 3 years to do it. Recent study found that lockdown saved as few as 1,700 lives in England and Wales in the spring of 2020. What would you say in response to that?
Well, I think you're talking about the Johns Hopkins.
I am.
I don't recognise any of those numbers. I think that was a bogus report. If you look at it carefully, it's unbelievably selective about how they choose their evidence. I really wouldn't lean on it at all.
So you completely dispute?
Totally dispute it and reject it.
Although we did see what happened in Sweden. They nowhere near had as much of a lockdown as we did here in the UK, and yet, comparably, the figures were similar.
No, I think Sweden, the Swedish authorities have apologised for some of the mistakes that they made in Sweden. I don't think it was a perfect case. And here in the UK, we did try to mitigate lockdown. I was involved in, you'll remember, regional lockdowns where we tried to have as little an impact as possible by trying to lock down bits of England and Scotland one place at a time. It didn't work. It was a highly, highly communicable disease. If anything, the doctrine we got wrong is that we should have hit it earlier and we should have hit it harder. And that would have been probably the most effective way of doing things and what I think the inquiry will end up with.
So with hindsight, you didn't know what you were doing?
We knew what we were doing in as much as we had some very good clinical advice from the CMO's office, but no one had ever seen a pandemic like this one before, and every pandemic has unique features to it.
We have seen one pandemic like
Not like this, not with something that is airborne, with such a communicable transmission rate. Well, that was a very long time ago.
Well, still a pandemic, and we still have seen it like this before.
I wasn't around in those days. And also, even then, they didn't understand, and we still don't understand some things about Spanish flu. There wasn't a clear precedent for this. And for instance, the fact that you could get the disease more than once, again, very, very unusual and unexpected. Living through the pandemic response as a minister, I was surprised every single day by new data, new twists and turns in this extremely unusual and horrible virus that came and hit us. And we tried our hardest to keep up with it. But yes, it threw surprises at us for sure.
Good to talk to you. Thanks very much,
Thanks, Kate.
for joining us both.